One of the most common questions we see here in the clinic is, Doc, I have arthritis. What is it and can you fix it? That's why we made this video for you today, so you can understand what arthritis is, what are the treatment options, and more importantly, at the end of this video, when you hear that word arthritis, you're going to think, I need a chiropractor. Now, there are many different types of arthritis, and we treat them all, but primarily there are rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. And recent research has shown us that 65 million people are suffering with arthritis according to the CDC. That's showing us that aging really is inevitable. But here in this video, we're going to focus primarily on the primary cause of arthritis, which is osteoarthritis. Let's break down this word arthritis. What an interesting word. Arthro means joint, itis, inflammation. Arthritis means joint inflammation. Now my arms here can represent bones. When two bones meet, it forms a joint. Every single joint in our body has a joint capsule, which is almost like a seatbelt. And inside that seatbelt is a liquid fluid called synovial fluid. This helps keep the joint lubricated and moving correctly. Now, if inflammation goes into that area, you may experience dull, achy pain throughout the night, decreased range of motion, even numbness and tingling. But more importantly, I'm sure you want to know how arthritis really happens in the first place. And it's really due to the stress we put on our spine. And sometimes it's from sitting, poor posture, or even gravity can cause stress to the spine that it's not used to, causing these bones to fatigue and slide out of place. When these bones slide out of place, it causes the joint to lock. That can cause muscle spasm, local irritation, and pain. But more importantly, it affects the joints above it and below it, because the joints above it now have to take on aberrant motion to take up the slack from the lack of motion of the ones below. This can lead to irritation and local interference to the tissues around the surrounding area. And our body has a natural defense mechanism which sends inflammation to help it heal, as inflammation is a great source of blood flow, white blood cells, and other nutrients that help tissues heal. The problem is, if undetected, that inflammation can sit in that joint and our body has a defense mechanism to get rid of it. So research shows us within 2 weeks, our body takes calcium from other parts of our body and starts laying down new fresh bone to get rid of that inflammation. Now you can see here on this chart, this is a great example of a normal disc. See the normal motion? You can see the liquid in the middle. It's hydrated. Now the joint gets stuck and we start to degenerate. That degeneration dehydrates the joint, which can decrease the disc space, causing pain and local irritation, as you can see that numbness going down the nerve. Eventually the body starts to fill it in with calcium, causing bone spurs and other types of pathologies. That's why it's critical that you come get natural care. We do not need to take NSAIDs or other types of anti-inflammatories, as chiropractic is the #1 choice for these types of conditions. So if you're interested in taking a preventative approach to your arthritis, or maybe it's just pain relief, we must educate you that taking conventional approaches to this is not your best bet. As senior primary healthcare physician will only lead you to taking NSAIDs and anti-inflammatories, which can damage your kidney, but also not restore proper biomechanics to your spine, helping the tissue regenerate for the future. Now, there is only one #1 treatment method, and it's no-brainer. Chiropractors are experts in the spine. Chiropractic is the #1 choice for preventing arthritis in the future, as our main goal is to make sure every single joint in your entire body is functioning how it should, whether it's your spine, hips, knees, ankles. We're going to restore normal motion in those joints to increase lubrication, to prevent arthritis, enhance blood flow. That way the tissue can regenerate for the future, preventing symptoms that you're having from getting worse, or even new symptoms from arising. Now, patients ask, will I be able to recover fully from where I'm at? Of course you can. That's why we take full spinal x-rays here in the office to not only analyze where the site of the pain is at, but see the overall health of your spine. That way we can be preventative and give the right treatment plans for the future. Now you can see here on this chart, we have four phases of spinal degeneration. Our main goal is to make sure that you do not dip into this phase 3 or phase 4, as those are mainly just pain relief and the damage has already been done. So come and get chiropractic adjustments, whether it's for pain, but more importantly for prevention. You come to the chiropractor to keep your joints healthy. You wouldn't expect to go to the dentist one time and have healthy teeth, right? Your spine's no different. So I'm looking forward to treating you, educating you about the future, and seeing you live your best life.